how does stress play a role in our oral health?
What we've come to discover, Candace, is that chronic stress has an impact in general on our immune system and on our body's ability to both fight and to recover from infections such as periodontal disease, an infection that 1 out of 2 of us have. Specifically, the research that was just released shows that chronic stress can have an impact on the flow of saliva in our mouths. And I think most of us don't pay much attention to the saliva that's in our mouth, but the fact is it's protective in nature. Among other things, it helps wash bacteria away from the teeth. And when there's insufficient saliva, more bacteria builds up around the teeth and gums, which can result in cavities as well as periodontal disease or gum disease. And not only can that loss of gum and bone cause people to lose teeth, but at that point, that level of disease can have an adverse impact in terms of elevating a person's risk of cardiovascular disease or stroke. It can complicate the management of diabetes, and it can even have an adverse impact on women who are pregnant.
So what are some of the risk factors for periodontal disease?
One is genetic. Some of us are simply more susceptible to periodontal disease than others, but smoking is a very common one. People that smoke a pack of cigarettes a day are typically about 5 to 6 times or more susceptible to periodontal disease than they would be if they weren't smoking. Type 2 diabetes, which is very common, also tends to cause an elevated risk of periodontal disease because of the impact on the immune system and the impact on our ability to heal, just to name 2 of the most common ones.
And can you tell us about the risk it poses for pregnant women?
It appears that the common denominator of the effect of untreated periodontal disease in these aspects of our overall health is inflammation. The bacteria that causes the inflammation and infection and the chemicals that are produced circulate through the body when the disease is untreated. It raises what people sometimes refer to as our inflammatory burden. When it comes to women who are pregnant, that increased inflammatory burden can trigger early labor, which can result in premature babies as well as low birth weight babies.
And can periodontal disease be prevented?
Absolutely. Periodontal disease is a bacterial infection, and if a patient is diligent in removing the film of bacteria that accumulates around the teeth, between the teeth, and under the gum on a daily basis, that disease is very unlikely to occur. And that's why I always encourage patients, work with a periodontist who are specialists in the diagnosis and treatment of this disease, who can work with the patient and work with their dentist and their hygienist to, number one, determine if there's a problem, and if there's not, we can work together to make sure that you have the skills and the tools so that you don't fall into this problem. But if there is a problem, the periodontist and the dentist and the hygienist can work together to help you get rid of the infection, repair the damage, and then create a program just for you that will help you not become infected again and to maintain a healthy mouth for the rest of your life.
Are there any symptoms that people should watch out for?
You know, the most common one that my patients report to me is gums bleed when they brush their teeth. Others are bad taste or a bad breath. Some patients come in and they notice that there's actually changes in the level of the gums around the teeth, maybe even shifting and moving of teeth. But I would say far and away the most common would be complaints about their breath and bleeding when they brush their teeth.
And do you have any additional tips or information you could share with us?
I'd love to suggest to your listeners to go to our Academy's website, which is perio.org, perio.org. There's 2 things that I think your listeners may find useful. The first is just some basic information about periodontal disease, how it's diagnosed, what the symptoms are, how it's treated, what impact it can have on you if you choose not to treat it. And number 2, there's an easy to find list of periodontists in the areas where your listeners are so that they can find someone with whom they can work who will also work with that patient's dentist and hygienist to work together, get them healthy, keep them healthy.
Wonderful. Well, thank you so much, Dr. Daniel. I appreciate you taking time out of your busy schedule to speak with me today. Have a great afternoon.
And you as well, Candace. Thank you for the opportunity.
Absolutely. Thank you so much. Have a wonderful day.
Bye-bye. You
Bye-bye.
too.